Focusing on strengths is a fairly new approach in mental health services. In the American Psychological Association's curriculum on recovery, they point out that in the past, intake assessments have rarely asked questions about the positive aspects of the client's life and generally does not emphasize the strengths, resilience, and accomplishments of the person. Instead, such assessments have relied on a deficit model focused on symptoms, impairments, diagnosis, problematic behaviors, failures in social, educational, and vocational pursuits, and difficulties experienced in living. However, according to a review article summarizing the evolution of the strengths model over the past 40 years, quote, in mental health, the recovery movement, now codified in the policies of the United States and many other countries, has moved the strengths model to mainline thought, end quote. The shift in emphasis to strengths is partly influenced by SAMHSA, the Substance Abuse and Mental Health Services Administration, which is the agency within the U.S. Department of Health and Human Services that leads public health efforts to advance the behavioral health of the nation. In particular, its mission is to reduce the impact of substance abuse and mental illness on America's communities. SAMHSA views the strengths-based approach as a key component of recovery, and it defines strength-based as focusing on, quote, valuing and building on the multiple capacities, resiliencies, talents, coping abilities, and inherent worth of individuals, end quote. According to the American Psychological Association's curriculum on recovery, assessment of strengths involves evaluating, quote, emotional and behavioral skills, competencies and characteristics that create a sense of personal accomplishment, contribute to satisfying relationships with family members, peers, and adults, enhance one's ability to deal with adversity and stress, and promote one's personal, social, and academic development, end quote. In one survey, a well-documented strength for many mental health service recipients is their spirituality. Over 80% of people with serious mental illnesses report that, quote, spirituality was important to their mental health, end quote. Religion and spirituality are associated with lower rates of depression, anxiety, suicide, dementia, and stress-related illness. Oman summarized the findings as indicating that, quote, on both the individual and community levels, engagement in spirituality and/or religion commonly gives access to social support and a wide range of other coping resources, some of them distinctive to religion and spirituality, end quote. Pamela Hayes is a psychologist who has been working with Alaskan Native people for about 10 years with Peninsula Community Health Services and Kenaitze Tribes Family Center. She uses the broader term culturally competent practice, which she defines as an approach that, quote, draws attention to strengths and supports that have a cultural connection. The explicit consideration of culturally related strengths and supports is important to draw attention to culture as a resource. She has created a list of culturally related personal strengths. Let's go over this list to give an example from one cultural setting of what is meant by strengths. We are focusing on the ones that have some overlap with religion and spirituality, so a few on our list were skipped. Some of these strengths overlap with the assessment area in the SOP we are calling personal religion and spirituality, and some of these overlap with organized religion and spirituality. This is why it takes some training to master the SOP interview. The first strength she lists is pride in one's culture and identity. Wearing traditional dress is one way to express this feeling of connection to a heritage. Second on her list is religious faith and spirituality, meaning a client's explicit connection to a religious faith, which can include indigenous beliefs and practices, as well as beliefs and practices from Christianity or other religions. This type of pride is often expressed in public participation in traditional celebrations and rituals, such as these dancers. Dr. Hayes includes artistic abilities, such as weaving, beading, and sewing. Here's a beaded knife sheath from the Tahltan tribe in Canada. So if an activity such as beading is important to a person and enables them to feel connected to others and to their heritage, then beading can be considered a personal spiritual strength. Another strength is bilingual and multilingual skills. Many people view their language as connected to their spirituality, especially if they learn prayers and chants in their native language. Another strength is culturally related knowledge and practical living skills, such as fishing, hunting, farming, and the use of medicinal plants. Here too, these traditional activities, even though they bring food to the table, can also, for many, be part of their spirituality by connecting them to their heritage through participating in activities such as their ancestors did. The questions in this area elicit important religious coping beliefs and practices that support the client's well-being and mental health. They help identify the person's best qualities, motivations, and strategies that have helped them deal with past difficulties.